So, ladies and gentlemen, so as you know, I'm going to share with you my experiences and knowledges in the LHON patient management in Argentina. So let's talk about the international diagnosis and the dialogue on LHON.
Do you see my screen?
Yes. You need
Now,
to put it up.
please look at this page. This is my presentation.
Perfect. There you go.
Perfect.
Excellent.
So today, let's talk about the LHON patient management in Argentina. I would be very happy to share with you my experiences in Argentina. By the way, I'm from the University of Buenos Aires. I have been dedicated to LHON for many, many years. As you know, Argentina has about 48 million population. And what's happening in Argentina? Let's talk about the LHON. In Argentina, we have about 48 million of the population. And out of that, 25% would have visual disabilities. And if you look at the LHON's prevalence, it is 1 to 30,000 ratio, which means there will be around 900 to 1,500 patients.
Can you please respond?
Sí, señorita Marcela, ¿estás?
English.
Now, if you look at this, if it's 10% was diagnosed as a genetic test, so Argentina, we roughly have 48 million population. So actually 10.2% was diagnosed as disabled people. Out of these disabled people, as I mentioned, 25% was diagnosed as visual defective patients. So in this way, we can see that out of these visual impaired people, about 95% with a confirmed genetic diagnosis, and some of them were totally blind. So in this way, we believe that altogether, as I said, 9 million, about 9 million patients. So we receive a lot of LHON patients in our hospitals. So I should say 50% have received suggestions of the adenovirus as a palliative, and 10% of the patients who have done the genetic testing before. So we believe that we need to further improve the genetic test. So actually about 0.95% was diagnosed as LHON. But based on such a large population, we still believe this would be a big number of LHON patients. So as you know, for idibenam, it is a quite expensive therapy. A lot of families cannot really afford that expensive pills. Very luckily, we have been collaborating with China. We send about 10 patients to China to receive the genetic therapy. So you can see that LHON is a horrible disease because the patients suddenly lost their vision. It is really very hard psychologically to accept this as a patient as well as their families. So that's why we started to make researches on the origin of such disease. So firstly, we would provide completive eye exams. For example, the refraction, the fundus, the color test, and the pupillary reflexes, and the ocular motility, and electrophysiology, and also the VF and OCT exams, etc. So we should say that we provide comprehensive examinations and diagnosis for the patients. And we definitely also provide neurological examinations. As Lisa have said, this disease is quite terrible for the patients and the families because it has a huge impact on its families. And also the curing of such disease tended to be quite long and is quite costly. It is a huge impact on the quality of life and a huge impact on the health cost and a whole or important loss of income due to the pathology. And there are a lot of high emotional and economic costs due to the continuous repetition of studies. And also there were a lot of clinical status, which is not so ideal due to the inappropriate or unnecessary treatments. So although it is a rare disease, but we invested very heavily in making research of such disease. So our vision is to help those patients and their families to get rid of such disease and get back to the social and normal social life as soon as possible. So we believe that for LHON disease, actually the diagnosis and the treatment was quite bumpy in Argentina. So there are a lot of steps got involved. For example, these are the roadmap we have gone through, the journey we have gone through and also we had a simulation of what a patient may go through in this page. Because a lot of patients would have the sudden visual loss when he is at a young age. So the diminishing of the first eye may not be that sensible because he has the other eyesight, which is normal. However, overnight, maybe the patient will lose the second eye of vision. So this is really, really horrible for the patients. The families may take them to the hospital, the hospitalization for studies and the laboratories, and it takes a long time for them to do a lot of, diagnosis and the testing, the corticosteroids and different ophthalmological studies and MRIs and even lumbar puncture are indicated. Although with so many diagnoses, but some of the disease are not fully diagnosed yet. So actually for central scotoma and the negative laboratory and the generic test is requested. So actually if the study is positive for any of the 3 primary mutations, it is considered DX positive. And if no, then secondary mutations in the primary or other secondary mitochondrial genes are evaluated. And during this process, it is recommended that not to smoke or drink alcohol, quality of life evaluation, and idiom 900 milligrams daily is indicated. Then it is controlled every 3 months and ophthalmic are indicated. There are also some following steps. So actually during the whole process, we also need to thinking as patients and families. There are a lot of psychological changes because there are fear of the future. They are also fearing that they may get blind. This is normal for people to have a lot of anxiety and panic because if they felt that they may not gain back the vision again, that's really the worst thing which can happen to his life. So that's why we need to help them because we understand that this is a genetic disease. So that's why we started the genetic counseling to provide to our patients. We understand there is an imperative need for the genetic treatment to avoid the odyssey of diagnosis. We do see that a lot of consequences of this disease can be visible, and we need appropriate counseling, mitigates the negative feelings, which can help the patients. You know, as a disabled people, there are a lot of laws and regulations to help them. In Argentina, we have a law which says comprehensive health care for people with EPOE and their families, so which was promulgated in June 2011 and regulated in 2015. And also, according to the Article 25 to 26 of Health of Law, we do see that the Convention on the Rights of the Person with Disabilities, which says persons with disabilities have the right to enjoy the highest possible level of health without discrimination. And the United Nations also announced some document which says we need to promote and protect the human rights of all the people, including the approximately 300 million people living with a rare disease worldwide. So during the such process, as a doctor, and we need to sit together and collaborate together with our patient. We should think as a patient, and we should help our patients not only in the we have to provide a full range of consultation as well as help to our patients. So the first step is developing our database. And also we have a lot of help from the NGOs and the government and all the stakeholders. We already have released a lot of laws and regulations to help the patients to receive free treatment. So sequencing programs for fully anonymized patients in accordance with personal data protection law. And also, we have outlined the steps of such trials. Firstly, you have to identify a trial. Then secondly, you have to make sure the legitimate is right. We would like to thank Dr. Li from Wuhan University. Well, I'm looking forward to participate in the China project in the future, as we already received a lot of tremendous help from them. Actually, we had already had a very good collaboration with Chinese hospitals, for example, like the Taihe Hospital, and also from the Huazhong University of Science and Technology teams. We sent out 10 patients to China and received a lot of treatment and surgery. They spent about 1 month in China. After 1 month of treatment in China, the patients, a lot of them have changed their life. They have recovered and their vision has been regained. And there are a lot of very, very positive feedback and outcomes from the patients. For example, there were patients who lost their sight. He is a young man who is in his 20s. So after the treatment in China, he can ride bikes again. And also there is a young kid who is as young as only 10 years old. He can get back to his coursework, and he is able to do his homework as a normal kid. So this is so exciting. As for Latin American patients, and for we believe this is very positive news, and it's quite inspiring for many, many other patients. And let me share with you another example, which is a patient had been diagnosed for LHON for about 14 years. He was diagnosed back in 2008 or even earlier. And actually in 2018, after treatment, he already regained his vision. And he has, and in 2021, his vision has been recovered very successfully. And this, he can do a lot of carpenter work by himself, and he has gained normal life back. So this is really exciting. You know, the patients benefit most out of that because they are able to regain their life back. There is another young man who was diagnosed with LHON before 2015. If you compare his study notes he took in 2015, you can see that there are a lot of blurring sites for him, and he really cannot take good notes. But after the treatment, you can see that he can play ping pong ball in his backyard. This is a fundamental change. So as a researcher and a doctor, we believe there's a long journey to go, but this is our responsibility to tackle the challenges in this regards. And hopefully that the neuro-ophthalmologist and the pediatric ophthalmologist and the pediatric neurologist and the geneticists, we should join hands together. I'm so glad that we can attend such a wonderful international conference like today. I would like to share with everybody more of my experience if there were chances in the future. And in the future, we are looking forward to further participate in LHON and some other related research and the doctors training, physicians training, and we are looking forward to join hands with China again. So we believe that the science and the bioethics and the training of the ophthalmologists in LHON and IRDS is very, very necessary. And in Argentina, we need to receive so many resources to help to diagnose and cure such horrible disease. And I'm really looking forward to joining hands together with everybody. Every Monday, in my university, I would call on such meetings to talk about what we can do more in this regards. Not only Argentina, but all the other nations, we believe that we are not alone in exploring this disease. We need to learn from each other because we receive different patients and we gain a lot of experiences. So we believe that the success in the development of the advanced therapist taking care of the patient's safety depends on the collaboration between all the stakeholders. The stakeholders involving the researchers like us and the government, like China, like Argentina, like the United Nations and America, and also Latin American countries, and also industry and the patients. Thank you very much.